Hello. In less than 2 minutes, I'm going to tell you all you need to know about hepatitis B and why it is important to protect yourself against it. Now, hepatitis is the inflammation of the liver. Simply put, an infection of the liver or a disease of the liver. There are 5 types of hepatitis. That is hepatitis A, B, C, D, and E. Now, hepatitis A and E can be acquired through contaminated food. Hepatitis B and C can be acquired through body fluids such as blood and saliva. Hepatitis D is what I call the dependent hepatitis because you can only get hepatitis D if you already have hepatitis B. Out of these 5 types of hepatitis, the most common and then the most serious is hepatitis B. So let's talk about hepatitis B. Hepatitis B is caused by hepatitis B virus, and this virus causes destruction to the liver. Your liver is responsible for all metabolic processes in your body, from production of proteins, hormones, to destruction of toxins, and many more. This hepatitis B virus can be transmitted in so many ways, from mother to child during childbirth, which is the most common way, by getting into contact with contaminated fluid, especially during sex. This means body fluids such as blood, saliva, vaginal fluid, semen, can be means of transmission of this particular virus. Another means of transmitting this virus is by the sharing of sharp objects. So those instruments Abochi have been using to cut your nails can also be a mean of transmitting of this virus. Another thing you need to know is that hepatitis B can occur in 2 ways. It can be acute and it can be chronic. It being acute means that the onset or the duration of the disease is very short, but can be very severe. This acute form normally occurs in people that get into their adulthood before getting the virus. One thing about the acute form is that it does not have medication, but it can be treated symptomatically. What this means is that normally they present with symptoms such as nausea and vomiting, abdominal pain, headache, fever, and all of those stuff. When that is happening, we give medications to cure the various symptoms, but no medication for the particular disease. In the acute form, if your immune system is strong, this disease can be cured on its own. Otherwise, it can lead to liver failure and death. Now, the chronic form is normally gotten from birth, where an infected mother transmits the disease to the child during childbirth. In this situation, that child carries this particular virus throughout his or her whole life. There have also been situations where people get infected with this disease in their adulthood, and the disease remains chronic and asymptomatic. In these situations, we are not even aware they have the hepatitis B virus. This means that in a chronic form, the disease becomes a long-term thing and it stays with you throughout your life. It can later on cause liver cancer or liver cirrhosis. Normally, in the chronic form, antiviral medications are given to manage the